5 features. These are just a few points I put down about what a portal or a web intervention should compose of. A portal has to be effective, has to be easy to use, it has to be very engaging, it has to be enjoyable, and it has to be empowering. So those are things that anyone who's embarking on an initiative to produce such a portal or such a service has to keep in mind. If the tool is not easy, that's it. If you're lucky to have someone try it once, and that will be the last time they ever use the tool. It won't happen again. They won't access your website. It has to be engaging, enjoyable, and empowering. And basically, if it's not easy or enjoyable, it won't be effective as well. So those things are really interconnected. Just a few words about engagement. So patient engagement is the blockbuster drug of the century. And that was Dr. Farzad Mustashari, who was the national coordinator for Health IT in the United States, talked about. So here's where really a lot of the work and the focus has to be. And it's easy to say, okay, we're going to develop this beautiful portal. It has all these beautiful icons and click here and drop downs, or it's pleasing to the eye and all that. But okay, there's a development part that we have to take into account. But then there's also how do we get the people to stick to the intervention? And I think John talked about that. You want to do research, you want to look at your data, but if 1/3 of the users are not using it anymore, that's a loss to your disservice actually to the data itself, right? That's your analysis. Unfortunately, adherence is very low to these kind of interventions, and so we have to keep working on that. So this is the patient engagement framework from the National eHealth Collaborative, and I think this is a really nice PDF that you can download free from their website, and it has on it all the information related to different stages of patient engagement. And I can actually show you some of those. I'm not going to spend too much time there, but show you some of the parts. So the first part is inform me. You can see here, so it's information, health encyclopedia, being able to print forms, and then have patient-specific education on your portal. Right? So that's the first stage. You go on to the second stage, which adds on to inform me, engage me. And then here, you can see the addition of e-tools, so tracking tools, fitness tools, tracking, health milestones on social media, interactive forms online, patient-specific education as well, but patient access to records, viewing the electronic health record. On top of that, you add on empowerment. Okay. And here you'll find we have added integrated forms, the electronic health record, but also importantly the last part here, which is patient-generated data, care experience surveys, symptom assessments, self-management diaries, and people have alluded to this in previous talks, and also different forms of records. And that's all to empower the client. A stage further, we add on partner with me, which is all the other stages plus partner with me. And you've got similar items there, and then collaborative care. So you have acute, primary care, long-term, post-acute care, and specialty care that integrates within your service.